an innovator said to me, actually said to the Secretary Sebelius at the big annual HINS conference a couple years ago, he said, data is oxygen for innovation. And there's just a lot more oxygen in the environment these days. And what he meant by that, I think, was when we say that patients have a right, they have the right under HIPAA, but they can actually now exercise that right through technology of downloading an electronic, structured copy of their medical record and doing with it what they please, right? Once I've downloaded it, I can do with it whatever I want, right? And there are going to be, and this is CajunCodeFest. I was actually in Lafayette, Louisiana. It's a really great place, great food, great music, and great innovation there with a hospital that's looking, saying, we need to totally transform how we deliver care. And they brought these hackers in, these Codathon folks, for 27 hours straight, to take a Medicaid claims file and say, what can you do if we give this to the patient? If we give 3 years of Medicaid claims data to the patient, what can you do with it to help them manage their immunizations, manage their medications, do medication adherence, understand the total cost of their health care? Think about all the things you can do once you turn that data loose to the patient so they can control it. We've done that with Medicare, right? I have here 3 years of my mom's claims history and an app that helps me make sense of it, right? And it helps us now say there is a whole ecosystem that can come out. So for stage 2 of meaningful use that takes effect, October of 2013 for hospitals, January 2014, every one of those hospitals and doctors is going to give the patient the ability to view their record online, to download their information, or to transmit it to a third party where they can be apps and services built on top of that data. That's where the two meet. So the meaningful use, the electronic health record incentive program for doctors and hospitals say what the, and it's now, I think, 85% of hospitals have registered for the program, 73% of doctors' offices. So this is a big change that's coming, and people will be able to get access to their own information, and there will be this ecosystem. I can see it now. There'll be an app for that, right? Where you're gonna have all sorts of application services built on top of the medical knowledge, the patient data, and the community structure.